Hi, everyone. We are here in the middle of February. Some of you are dealing with major thunderstorms and tornadoes rolling through the middle of the country in the middle of February. Is that not just an indicator that things are really, really weird? And we are celebrating because the Kansas City Chiefs won the Super Bowl, and the people associated with this production who are so incredibly tied to the Chiefs and great fans, and they're so happy, and it's so wonderful for them. And for those of you with Philadelphia roots, condolences. The Eagles played well. It was a great game, and really proud of both teams that they played an outstanding game, and it was played safely. So we are thankful for a great football season, and now we have baseball to look forward to. And this week, the Major League Baseball players presented to start baseball camp. So it won't be long, and we'll be watching baseball games. There's good news continuing to come forth. There is no better news this week than the Chinese finding no new significant variants in the population that has gotten sick in China. They've had a widespread, very, very large outbreak. We can only estimate in the hundreds of millions of people infected in China. And it's likely a large fatality rate, but we don't know that for sure. But what is really significant and news for the rest of the world is, despite all those infections, they're not finding significant risks of new variants coming from their population. And that there can't be any better news related to COVID than that. On the really technically wonderful news of the week, the federal government has said that they're going to put an end to our public health emergency, which has been present now almost 3 years. And it will be over 3 years by the time this ends. So May 11th, 2023 will be the end of the public health emergency related to COVID. What does that mean to you? What does that mean to me? What that means is COVID is not gone. It is present in our society like many other infectious diseases. Count the flu, count the norovirus, count tuberculosis, count any of the other infectious diseases that we have to deal with on a day-to-day basis. And they're dealt with by testing and treatment and prevention, all done through the routine health system, paid for by either insurance companies, consumers, or the federal government through Medicare and Medicaid. That is where we will move COVID and related infections into the normal day-to-day delivery of American healthcare. That's a good thing. Our disease load is down. Not all the complications are done, but the disease load is down far enough that it no longer has to be considered a public health emergency. What it means for a lot of consumers is their access to free stuff is going to be over for the most part. Companies are still coming up with policies now. And for example, one of the vaccine manufacturers has said that their product will continue to be offered for free. That may not continue, and there's no mandate for that. What it does mean is if you want any tests for COVID to remain around your house, you should probably get them now from public health, from your local pharmacies, if they're making them available, from your clinics, from your departments, if you're part of an organized public safety department. I have kept some of those, and we'll keep an inventory of them at the house so that we can tell whether a respiratory infection going through with the symptoms of COVID is still COVID. Those tests will be good for some time afterwards, but they will no longer be free and available to most people under most circumstances. There still may be millions of them sitting in a state's warehouse, and they may choose to offer them for free in a local public health warehouse, in one of the pharmacies, et cetera. But by plan, there will be no further free testing done. If you need treatment, right now it's available in general for free, but into the future, there will be a cost associated with that. either paid for by your insurance company or copays and deductibles. If you need further testing for other things, it will be under your health insurance, et cetera. So that's what's going to change in the kind of the technical world. And then other programs that relate to screening monoclonal antibodies, if we get those back, et cetera, will all be part of a local public health system program, a state program, or something that's offered through your health plan related to your department or your local clinics. I'll put it that way. It is likely that we will have a lot of work done going into the fall talking about the vaccines. And in the news now is what are going to be the components of COVID vaccines into the fall? Will we need protection bivalent or trivalent or a single one? Don't know. The FDA is studying that now, getting input from a lot of medical groups. What do we protect people from when it comes to the fall? There are still people, maybe even in your department or your office, that are getting COVID, and it's still yucky. It's still a respiratory congestion disease. There's still the risk of long COVID. If you've been vaccinated or if you've had it before, there's less risk of you having a serious infection, but it's still there. And some people, including some other medical directors I work with, have had COVID recently, and it still doesn't feel any better than it did 3 years ago. There are people who are testing positive. There are people who worried that they're infectious with it. None of those things have changed. There's still a 5-day period of time that we know of where it is likely that you're still infectious after you have symptoms. So a 5-day period of isolation is still indicated. We are not using quarantine any more than we're using quarantine for flu. If you think you're getting the flu, if you think you've been exposed to the flu, it's really not a good idea to go and expose yourself to a bunch of other people. A lot of people are wearing masks. I was on a plane over the past weekend. A lot of people still wearing masks. They are not wearing those necessarily for COVID. They're wearing them for flu and for RSV and for parapneumovirus and all these other things that spread this time of the year. And a simple mask is still a good way to protect yourself related to any of those types of diseases. Remember, masks have been protecting us for a long time. And there's been discussions about whether we should continue to use N95 masks or simple surgical masks or a simple face cover. I want you to be aware any of those will protect you from some stuff. For the most part, protection with a simple surgical mask is very effective and has been used for years in the hospitals, operating rooms, et cetera, to protect the providers from infections. It works very effectively. A higher level of protection comes from an N95, and the highest level of protection comes from full PPE, or for the fire service, self-contained breathing apparatus, et cetera. For our firefighters on this, you could go into a house fire wearing nothing. You could put your shirt up over your face. You could wear a surgical mask. You could wear an N95 mask. You could wear a canister respirator, or you can wear full air, air that you wear, your self-contained breathing apparatus. I think all of you would appreciate what the difference is in how you would do performing in a fire under those circumstances. So simple masks, simple surgical masks, still a very effective way to protect yourself from a lot of respiratory viruses, not just COVID. Long COVID still occurs in some people. It's very frustrating. It will be a problem for a while. We still have a lot of evolving science. There's no final answer on what long COVID is. We do believe that getting vaccinated, even after you've had COVID with long symptoms, does relieve some of the symptoms. We do believe that getting treatment when you're acutely ill with a medication like Paxlovid reduces your chances of getting serious infection and reduces your chances of getting long COVID. So those are things we know. For those of you familiar with this, our monoclonal antibodies are now effectively gone. They no longer, the ones that we have currently in production are no longer able to provide treatment for people who are early on in the disease. And so we don't have any of those injection products still available. There is one infusion product called remdesivir, 3 days of infusions in a row. Not very much used, but just so some of you are aware of that. And then there's new work going on with new forms of monoclonal antibodies, and then with drugs known as interferons that perhaps will be useful down the line as a tool in our toolbox for treatment of COVID. Nothing yet in that arena. Right now, our treatments available are Paxlovid and molnupiravir, and those are oral medicines, and then remdesivir for generally people admitted to the hospital, and those are infusion products that take a long time to give and have to be given 3 days in a row and are quite expensive. So as we move through the end of COVID, I want you to understand that terminology. I want you to understand what the end of the public health emergency means, what you might want to stock up on, like free tests that are still available. I want you to be aware that when you get COVID, you still are infectious. You still may feel crummy. Some people with underlying medical diseases may get really sick with COVID still, and there's still people dying of COVID or the complications of COVID, and that's still a tragedy. We have over 1 million deaths already in this country. It is likely already that the Chinese have had 1 million deaths. That was a statistic that was released today. Can't assure that it is a true fact, but just so we all have an idea that the Chinese have been heavily impacted over the last couple of months with COVID. And from there, we are getting close to kind of getting back to a normalcy in our healthcare system, in the way that we relate to each other. As you look at things like the concert schedule for the coming summer, acts are back out there. They're getting people together. There were big celebrations in Kansas City after the Chiefs win, and all of the things that we consider part of our normal day-to-day life are coming back. And we certainly hope that summertime will be kind of completely back to that, with COVID mostly in the rearview mirror. DocTalk is coming to you still, and we can discuss all kind of timely topics related to the DocTalks even after COVID goes away. What we have now is still wintertime. The groundhog predicted more winter. There was the palm tree in Florida that saw its shadow, and that meant there's 6 more weeks of sunshine for all of you who are interested in the prediction in Florida. When the palm tree sees its shadow, that's 6 more weeks of sunshine. But I wish you sunshine wherever you are in the country. Take care of yourselves, be safe, still some cold weather ahead. Take care and stay healthy. Thanks.